At this point, we're going to move to our next speaker. So I'd like to introduce Dr. Seema Yasmin. Dr. Yasmin is the director of the Stanford Health Communication Initiative, and she's going to talk to us today a bit about the issues in responsible reporting about coronavirus. Dr. Yasmin, please share your slides and your screen.
Good morning, everyone. Thank you so much for having me. I am going to start, sadly, on a personal note. I know for many of us entrenched in the numbers of this pandemic and studying it from a very academic perspective, it's also a very personal crisis. And yesterday, we learned that a dear friend and mentor and phenomenal HIV researcher, Professor Gita Ramji, died of COVID-19. And she was South Africa's chief scientist for HIV, director of the Medical Research Council's HIV research unit, and she had dedicated decades of her life to HIV prevention research. So, as much as we are studying this pandemic, we are also, I think it's fair to say, really heartbroken and stunned by the loss of our colleagues. So, I am a public health physician and a journalist. And I came to combine these careers, which may not sound like they should be combined, because I came to the States to serve as an officer in the Epidemic Intelligence Service. So I would be helicoptered into different hot zones and tasked with having to investigate contagion, to stop disease spreading, and to keep people safe as much as possible. And what I noticed very early on, and time after time with many epidemics, was that disease was not the only thing that was spreading. And yet my sole focus was containing a pathogen. What I would see, though, was that rumors, pseudoscience, health hoaxes, all of those things were spreading in tandem with the disease. And those were often helping fuel the spread of infection and leaving communities vulnerable to the disease and also to the spreading misinformation and disinformation. So I decided, after training as an epidemiologist and public health physician, that journalism is part of the public health ecosystem. And in order to be an effective public health physician, I needed to train as a journalist and learn how to share this information effectively. So I did that. I became a television reporter and a newspaper reporter, covered many epidemics, including Ebola and Zika, and then came to Stanford in 2017 as a Knight Fellow to really study how can journalists better cover epidemics and pandemics? How can we make sure we stay safe while doing our job? And how can we ensure that we do the best possible job at countering so many of these false narratives and making sure that people receive the information they need to be empowered, to make informed choices, and to stay healthy? Being a journalist covering epidemics and pandemics is really tough. You are thrust into a dynamic situation with numbers changing every day, and you have to make difficult decisions. Here's just one example from this pandemic. On March 7th, an Italian newspaper receives a leaked memo from an official with plans for a potential quarantine in northern Italy that would effectively restrict the movement of 16 million people. Now, if you were an editor at that newspaper, would you or would you not share that information with your readers about what might be headed their way? I don't know how you might make that decision, but this is the area that we're looking at. So what happened was the story was published. I believe those editors and reporters felt like it was in the public interest to share information about how this pandemic was evolving and how officials felt like they should be responding. So what happened? There was chaos. The leaked plans about the coronavirus quarantine sent thousands fleeing to train stations and bus stations to try and get the heck out of this area that they believed was about to go under imminent lockdown. And the next day, Italy reported its highest day-on-day cases from COVID-19 to that point. Of course, we saw things get much, much worse there. So I share this example to illustrate this point that you have to make tough calls, not just as public health officials about should you or should you not institute restrictions on movement, but also as journalists covering a public health crisis. How do you balance the ethics of keeping your audiences really informed about what's happening and also holding officials to account? And journalism has impact. And that's why many of us go into journalism, because we believe that information can empower people. As I mentioned, during a public health crisis, you can see a disease spread widely, but you see information spread widely as well. There's misinformation that spreads, that's false news that spread without the intent to cause malice. And there's also disinformation, which is false news that spread with the deliberate intent to cause harm. I won't go too much more into this idea of misinfodemics, which is what I study and I'm very interested in, because you're going to hear later from folks like Renee DiResta, who are experts in this field as well. There are many studies that show that false news can actually spread farther and faster than accurate information. So that's what we're up against during crises like this, not just a virus spreading at speed, but also harmful false news. This has happened many times before, not just with this pandemic. Here are just some of the rumors that we saw circulating during the Ebola epidemic. These can have very real consequences on the ability of people to trust healthcare providers, to seek treatment, and to be honest about how sick they might be feeling. We saw disinformation campaigns during the Ebola crisis. Yahoo News' Twitter account was hacked with this news, this false news, that there was an Ebola outbreak in Atlanta. There were more sophisticated breaks too, with a CNN website being duplicated and false news put on the homepage, alerting the public to this false outbreak of Ebola in Atlanta. A lot of this was done by the Internet Research Agency in Russia, with the idea of causing chaos and diverting emergency resources away from where they were really needed. I want to make sure that we're really hitting home the point that yes, we are in a pandemic situation now. This is a crisis.
1 minute.
But in terms of these misinfodemics, we are up against this all the time in terms of growing anti-science movements and anti-vaccination movements. So this is not by no means a new phenomenon, but I hope that we start taking this much more seriously as a public health community and making sure that when we deploy epidemic investigators like I used to be, that we're making sure that we're tackling not just the spread of disease, but also the spread of information that can hurt people. Just some more examples. We've seen Twitter bots and trolls stoking debate around vaccine safety where there is no debate. You may have heard of free press being described as the immune system of a democracy. And that's completely true. I think that you can use journalists effectively to counter false narratives, to hold the powerful to account. But unfortunately, my research has found that journalists are not well supported to cover public health crises. I've said time and time again, we need to make sure our reporters are safe and well trained in how to cover health and science. When I did my research, I talked to top editors at news organizations around the world, and many said they had no plan for covering a pandemic. And many of us in public health will say over and over, but these kinds of things are imminent. We've heard of folks saying they're winging it, and this is exactly how we wind up with reporters sick with the same infections they're trying to keep us informed about. Working on some solutions, don't have much time to get into them, but you can please reach me afterwards if you'd like more information about inoculation theory or the toolkit I'm producing for reporters. And in summary, we just really have to take seriously the concurrent spread of not just disease, but also misinformation and disinformation about disease. Thank you so much.